Okay, so I decided that since I did some tutorials for the Life and Death 2 operations, I should go ahead and do similar tutorials for the Life and Death 1 operations. Although I must say that the Life and Death 1 operations are not nearly as difficult as those in Life and Death 2. But let's go ahead and get started. There's basically two operations in this game, an appendectomy, which we will be doing first, and the other one is an aortic aneurysm surgery. So as before, I'm just going to go through all the materials we have at our disposal. You open up the top drawer, you've got the soap and the gloves. Obviously, those are to be used first. The antiseptic is going to be used for clearing off the surgical area and preventing infections. You've got the surgical drape. I'll explain that when I get to it. The gauze is used some time into the surgery when you actually get to where the large intestine is. It's used for sort of immobilizing things. You'll see what I mean when I get there. In the lower drawer, you've got your glucose, blood, and saline. As you probably remember from Life and Death 2, they fulfill basically the same roles. You want to have blood in the IV as long as you're doing some kind of cutting that's going to make the patient bleed. It'll prevent blood pressure from dropping. You've got this test tube here, which again, when you get down to the large intestine, there's going to be some fluid or something. I'm not exactly sure what it is, but you need to take a sample of it before you continue on with the operation so that you can analyze the fluid or whatever. You got your antibiotics to prevent infection. Dopamine raises blood pressure if it drops too low. Lidocaine and atropine are used for fixing cardiac arrhythmia. Lidocaine for premature ventricular contraction. On the EKG, that looks like similar to this, but in the middle, rather than going up and then down and then back, it just goes down and then back to the middle. And atropine for bradycardia, that basically just looks like a flat line in the middle here with the two bumps on either side. So that's how those work. And you've got your scalpel, you know what that's for. Your skin clips, that's basically the same as the skin staples from Life and Death 2. It's used for closing up the skin. Suction cup is used for sucking away that fluid that I mentioned earlier. Your cauterizer, used for closing up bleeders. The retractor is used for opening up a particular layer that you're cutting through to get to the next layer. The clamps, those are only used sort of in a particular sort of special areas in this that was really a fantastic time for my headphones to cut out. Anyway, clamps, those are used for stopping up bleeders and some other things. I'll explain that when I get there. Sponge for cleaning stuff up. Sutures for closing up tissue layers and for a couple other things. And the scissors are used for cutting through tissue layers. Anyway, let's get started. First thing you want to do is soap and gloves, of course, and then antiseptic. Just rub it all over and you'll get some nice little black dots showing up that just shows you where you've already antiseptic. That's not even a word. Anyway, just really all over. As much coverage as you can get, that should be fine. For the drape, click and hold and you can drag it around. You can make it whatever size you want, but there's no reason not to make it as big as possible to give you as much area in here. Oh yeah, actually I probably wanted to mention this thing. I have absolutely no idea what this thing does. I just completely ignore it. It doesn't seem to do anything at all. Anyway, now we can inject the patient with antibiotics and make sure you turn on the gas before you start. And now I'm going to start by putting blood in the IV because we're going to start cutting. So here you want to cut from the upper left to lower right in as straight a line as possible. Something like that. Now stop up bleeders with the clamps. You need to place the clamps near enough the center of each bleeder. You'll notice there's a little blip noise like that. That means you've successfully clamped the bleeder. If you don't get a blip noise, it means you've missed and you need to try again. Use the cauterizer. It makes the EKG go crazy, but that's to be expected. The assistants will tell you when you've gotten each successive bleeder, and then they'll say, great going, you got them all. That's what you want to see. Once you see that, you can start removing the clamps. Come on now. Wipe away the blood. retract. Do the same thing here. There's going to be some more bleeding. That wasn't the best incision I could have made, but whatever, it's good enough. They're really picky about your incisions in this game. If your incisions aren't straight enough, then they will consider you to have technically failed the operation. They don't like that. So be as straight as you can with your incisions, I mean. Now, more cautery. Oh wait, we've got a bradycardia heart rhythm. I didn't notice because of all the cautery going on. So for that, you use atropine. Now, where was I? Ah, god damn it. There we go, lidocaine. Where was I? There we go. Successfully cauterized all known bleeders. That's what I like to see. Thank you, Dr. Manglier. All right. Wipe that down. From here on out, there's not going to be much in the way of bleeding, so you can replace that with saline. Open that up. Now here's a muscle layer. And you want to go cut right along with the muscle grain. Again, you need to be very precise. The muscle layers don't bleed, so you can just retract and go to the next one. Here, we need to go from upper right to lower left, again, along with the grain of the muscle. Retract. Now here's a tissue layer. Now what you need to do is begin by first scraping at the upper left with your scalpel, and remember approximately where you scraped. Just click once. You've scraped it, doctor. Now take your clamp or your forceps and raise it at about that area. Just put the forceps right there, and then click again to make a little hole. And now you use the scissors, just sort of click, click, click to snip your way through this layer. That should be fine. Now you can take that off. It wasn't very straight up here, but that's fine. And retract. The peritoneum has been retracted. So now we need to take our, that's the wrong drawer, take our fluid sample, and then suction away the rest of the fluid. Now you click on the lower end of the large intestine here to pull out the cecum, and then you need to pack it with gauze in order to immobilize it. Like so. Just click there. Now, some atropine for you. Now click twice to pull out the appendix, like so, and use your clamps at the end out here. Click, click to raise it. Take care of cardiac arrhythmia as necessary. Now you take your scalpel, and there's sort of a little triangle kind of shape going on here. Right in the center of that, click once and you'll make a little hole. Take your sutures and suture it off through the hole, like so. Tie off the mesoappendix artery. Getting low on saline there, so I'm going to put some more in place. Now, with the mesoappendix artery tied off, you can use your scissors, and there are these sort of two prongs of the clamps. Just cut sort of right below the right one. That should do it. Remove the mesoappendix membrane, and now some more clamps. You'll see there's sort of a dark reddish line running up the appendix here. Take one clamp, put it at the lower end of that. The low clamp has been successfully placed. Take the other one and put it maybe a third or so of the way up. Put those two clamps there, and now cut it with the scalpel. I think the scissors will also work, but I used the scalpel. And sever and remove the appendix. Now remove the clamp. Click here to invert the stump of the appendix, and then take your suture and click once to make a Z suture there. Remove the appendix to the intestinal cavity, and we can begin retracting. Now all we need to do is suture things up. You don't need to be too careful with these sutures. If you make a mistake, you can always cut a suture away with the scissors, but I'm not going to do that right now. I think you get a maximum of 30 sutures per layer. I believe I counted that out once. But don't worry too much about it. They don't need to be super tight or anything. For those arrhythmias, you can just sort of click anywhere inside the surgical area. It doesn't really matter. Damn it. Atropine. Okay, now we can continue with our suturing. continue with our suturing. Suture, 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 suture. And skin clips. I'm going to refill the saline bottle there once more. You only got a limited amount of fluids here. So again, they're a bit particular about the spacing of these clips. I think they only really care about the vertical spacing and not the horizontal spacing. I haven't really figured that out yet, but if these skin clips are unevenly spaced, again, they will say that you had failed the operation, which is never good. So just sort of make them, at least in terms of the vertical spacing, as evenly spaced as you can. I don't think it really needs to be pixel perfect, but, you know, do your best with it. And I think, yeah, I'll put one more, because why not? And that's pretty much it. Once you turn the gas off, the operation will be finished. And also at that point, DOSBox will change video mode, so it'll sort of cut off this this segment of the video. But hopefully, if you follow all of that closely enough, it should have been a successful operation. Like I said, they are a little bit picky about certain things. They may need you to go back and retry the operation again. If they want you to retry the operation, they'll send you back to the medical school for a lecture, and they'll tell you what you did wrong. But that is how you do the appendectomy operation. I'll see you next time for the aortic aneurysm.